Well, one of the things that you see from the data is that early on in the pandemic, the average age of hospitalizations was 64. That has dropped 10 years down to 54, and the reason is the elderly population got vaccinated. They're reducing the numbers going to the hospital, but it is that age group between 30 and 54 that is becoming ill, that has not been vaccinated, not good vaccination rates, and so that hospitalization rate has increased. And so what do we do about it? We're working very hard to go to that population through the employer, through trusted advisors such as the clinics, making sure they have the information and overcoming the hesitancy or just the simply we're putting it off approach. I've started community conversations, going to cities. I'll be in 6 cities next week in Arkansas, simply talking about what are the concerns, what are the community ideas to how we can do this better in terms of increasing that population and their vaccination rate.
How do you explain this partisan divide on vaccinations?
Well, you know, there shouldn't be a partisan divide, first of all, but clearly a conservative is more hesitant about government authority. That's just the nature of it. And so I think in southern states and some rural states, you have that more conservative approach, skepticism about government. And we just have to answer it just like we have all through history, that you overcome skepticism and mistrust by truth. You overcome resistance and obstinance with saying that it's important for our community and it's important for the health of our state and nation. And so I think that's simply the nature of the different views of government. We've got to overcome that mistrust because Republicans, Democrats, we all suffer the same consequence if the Delta variant gets us and we're not vaccinated.